topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Afternoon, Dallas-Fort Worth. God, I lived in the Dallas-Fort Worth area for close to 20 years. I'm now in the Florida area. Hey, I can't wait to share this information with our next expert, Dr. Daniela Gamboa. It just happened this afternoon, and I haven't had time to share this with her. Dr. Gamboa knows that we are now on TikTok, and I got to tell you, we're on 70 platforms, and I got to tell you, we are getting more eyes and ears on this show on TikTok than any other of our platforms that we do. And people start writing their questions in, and I think Dr. Gamboa is going to smile. We've got so many things to talk about, but people want to hear about the skinny injection, Dr. Gamboa. Everybody wants to know about it. Can you hear me okay?
Hi, Steve. I think I lost you for a little bit for some. I can hear you now. Can you hear me? Because I think I lost you for a few minutes because I don't know, my internet went blank.
It's okay. We have you. That's fine. So I was telling, we've got all these new people on TikTok, and when we were promoting your show today, we got inundated by people wanting to know about if you could talk about weight loss, the skinny injection, and hormone replacement, which we've talked about on so many shows. But since we've got this whole new audience, and I really want to introduce them to you, hopefully we can talk a little bit about weight loss today and these injections.
Oh, yes, the injections. And also, before we are going to dive in the injections, I would just make a little update for you. And it's just to update the population in general, all the patients, everyone listening out there, because I don't know if you heard, but PCOS, formerly, it was polycystic ovarian syndrome, and now has a new name. So it has a polyendocrine metabolic ovarian syndrome. It sounds like a mouthful, but it's much better because now we fully understand, finally, after so many years, this update came to help patients be better diagnosed. Before, I think the former name of PCOS, it was a little misleading because we were thinking, to make the diagnosis, we have to have or show or demonstrate cysts on the ovaries. And that was not the case. So many people went undiagnosed for many years. And now we understand that the PMOS, there are different types, and it's related to hormones, to insulin resistance. And it's going to help people and also bring that up to your providers, to your doctors. And if you're having times of your or months that you don't have a period, if you're having irregular period, if you're having more acne than usual, if you're having more hair than usual in females, hey, most likely your hormones are out of whack, your testosterone may be high, and you need to be tested and diagnosed and helped with this new entity.
So this has just happened?
Well, the name change, yes. Like there's like maybe like 2 weeks ago or so, like the Endocrine Society, like they came up like finally after so many years, like they came up to a consensus that hey, yes, like we should change the name because we have to help these people get better diagnosed and more help. Not only think, oh yes, like you don't have this because you don't have cysts in your ovaries. For many many years we were thinking that yes, that was the only way you could be diagnosed or have this. But I have so many patients that they don't have like all this like cysts in their ovaries, but they have the rest. Their hormones are out of whack, they have insulin resistance, and they're like normal weight. Before we used to think PCOS people, they're always overweight, they always have to have cysts in the ovaries, but it was not like that. So thank God, like now, like we have this better understanding and we're able to help patients. And many people, probably the females that are listening to me, are probably like, oh my gosh, I have that, or I was misdiagnosed, or I was just started on birth control, and you were not told that you have insulin resistance, that we have to help you with that, that you will develop pre-diabetes, diabetes in the long run, or have infertility if we don't treat you. So now, like women, we have a better voice, and then we have a better understanding to like come to the doctor and say, hey, I need help, I think I may have this.
Dr. Gamboa, one of the things we put when we were promoting your show today uh, is one of your specialties is functional medicine. I got so many people who wrote back saying, what is functional medicine? Can you help us there?
Oh, that's a great question. Yes, like so functional medicine is like we take care of the whole functioning body basically. Like we take care of the root of the problem. See how we're talking about the PMOS? Like we have to make sure that all we take in account everything, not one symptom. We have to look to the bottom of it. We have to find the root of the problem. And that's why we take care of the whole person, like trying to find out, hey, this symptom or this is affecting this other system. Let's figure this out, not just give you a medication for the symptom. And then we're like forgetting about all these other symptoms or like this other system that it's like suffering. For example, if you have iron deficiency, it's not only like your iron is the only thing low. The iron is so needed for like the conversion of some of the thyroid hormones, and that's only one example. Then it's needed for like the making the hemoglobin, the transportation of the oxygen, or making like the red blood cells and the oxygen transportation in the red blood cells. So it works in a different way. It's not, we have to find the root of the problem, and that's functional medicine. We treat you as a whole.
Yes. And do you see your practice partly being holistic medicine?
I would say like we do a lot of like wellness, like, and then also again, like I treat the patients as a whole, and I always try to find what's causing the problem, not just like think about um, uh, just giving a prescription for like a symptom or like diagnosing, but looking for the root of the problem. What is causing this? Why are you having anemia, for example? Are you having a um, colon cancer that's causing that? Are you having like this like bleeding that you're having, microscopic bleeding from an ulcer that you're having? So we don't know. Like, so are you having anemia because you are losing a lot of blood because of your irregular periods? So, or you're not absorbing as well. So many things that we have to look into, and not just, oh, you have anemia, take iron and that's it. No, we have to find out why you're having the anemia, what is going on. And that's what we try to do as much as possible.
We also put this in our promotional material to TikTok today about you, about bioidentical hormone replacement. And oh, did we get a lot of mail going, what is bioidentical hormone replacement? And you actually do in your practice hormone replacement.
Yes, like we do like hormone replacement, and whenever we say bioidentical, it's just basically that the structure of the hormones are basically the same as the ones that we use, right? Like the ones that we have. So like we try to always replace our hormones with the hormones that are as close as possible to our natural ones. We try to avoid the synthetic hormones, like there are so many FDA approved like bioidentical hormones to like help with the females, and also for males, like with the testosterone. So we try to always stick to what is the closest to our biology as possible, and try to help, because now we know that the hormone replacement provides so many benefits to all the patients, females and males. For the longest, the same way, like we were very scared, including myself, whenever I was doing my training back in the early 2000s, like whenever like we start doing our training, we were told, and the WHI came, the Women's Health Initiative, that, oh my gosh, like hormones were really bad, because we were going to cause like breast cancer, we were going to cause like strokes, we were going to cause heart attacks. And now we know that it was not as far from the truth. As now we understand the data, we understand what happened. Even the synthetic estrogen by itself at that time, after 17 years of like reviewing the data, it was found that the estrogen by itself was also providing certain uh, decreasing the risk or a certain protection against the development of like breast cancer. So as you can see, like it changes so much like what we've known before, and now with all this like research, and after many years of seeing and observing and seeing what's going on, that now we're happy to say that, or like pleased to say that hormones do not cause all these problems, especially like estrogen. Estrogen can save lives whenever it's placed vaginally to prevent the recurrence of like urinary tract infections. Instead of giving the females, like older females, antibiotic after an antibiotic after an antibiotic, or even like waiting for them to have like a severe infection called sepsis or urosepsis, then the treatment is just very simple. Start using vaginal estrogen 2 times a week, either like as a cream or a pill, and you should be much, much better with the time. And that's what we need to help the patients with.
So again, going back to some of the questions that we got, and I want to get into weight loss, but we just lost a IndyCar driver, 41 years old. They found that he had pneumonia. It turned into sepsis. How does that happen, doctor?
Well, I don't know the whole story, and I'm so sorry. Like our prayers are like with his family, and unfortunately, sometimes, because like if he was like doing through a lot of this stressful situations, right? Like racing like cars is like a lot of stress, like, so what happens is whenever we have too much stress, our cortisol levels go up, and that's the one that causes all the problems. So also a lot of stress is going to decrease your immune system. By decreasing your immune system, like of course opportunistic like bacteria are going to like get the best of you, and very likely, like because he was like always on the go, like always like trying to do the races, or like being on
Right.
a lot of the times we don't pay attention to our bodies, what our body is telling you. So it's possible that he didn't realize until it was too late. And even though he was young, a lot of the times whenever all this it's like whenever COVID happened, like it was mostly like all the inflammation, all this like cascade of like events that happens whenever you have sepsis, whenever like the bacteria overwhelms your immune system, we're not able to defend ourselves and everything. Then you start going into like multi-organ failure, like your start failing, your liver start failing. So unfortunately, even though you're young and you have like the bacteria like it's causing all this like problems, and that's why it's called sepsis, and your blood pressure drops, like then there's no blood pressure, there's no irrigation for your brain, there's no irrigation for your heart. So it's a cascade of like so many like inflammatory cytokines. It's like so many things that is going to happen, that is so unfortunate that happened to like such a young person.
Probably one of the most frustrating things to people is when it comes to dieting, and people have tried so many different types of diets, and it usually ends up coming back on them. Usually, in fact, it even comes back even more. Um, but what I've learned from doing your show, that stress and sleep play a big role in weight.
Oh yeah, definitely. Like, see how I was telling you about the stress and the cortisol? Same thing. So like if you don't sleep well, so then the cortisol levels go up. Whenever the cortisol levels go up, then what's going to happen? Your thyroid is not going to start working. You're going to start having like some insulin resistance. So everything is going to go up. Your hunger hormone goes up. So many things happen, and that's at the level of the reaction of it. But then also in the part of your brain. So remember, the brain also needs, like, just think like this. It's like whenever you have like a hospital or any area, and then you need to have a cleaning crew at night to get everything, all the toxins and everything out. So our brain has something similar. We call it the glymphatic system. So whenever like you sleep, you go into the deep sleep, then you have that cleaning crew to go ahead and decrease all those toxins, all the debris and everything that the cells like, and the use of energy cost, like all the toxins. But if you have a restful sleep, or you don't have enough sleep, there's not enough time for the lymphatic system to get rid of all the toxins. So that's why in the morning, whenever you have very little sleep, then you're also going to have like brain fog. You're going to be like not thinking very straight, because again, you didn't have time for all that toxins and everything to be like cleared from the day before, and depending on how much stress you had, like how much cortisol you had, how much like all these other issues that we're having. So that's what happens. And the same thing happens with the cortisol. So your hunger hormone goes up, and you start like eating more, like you eat more, your dopamine levels go higher, and then you feel better. So then you want to repeat, like go ahead and continue eating, because you want that good sensation, the feel good, the dopamine. So it's just a vicious circle. And what you were saying about the weight coming back, yes, unfortunately, that is a phenomenon called metabolic adaptation. So whenever you lose weight, unfortunately, we're not built to lose weight. We're built to gain weight, because the gaining weight is more like, oh, I have reserves, like I have like good like energy reserves for in cases I'm not going to have enough food. So whenever you lose weight, your body gives the signal that, hey, we need to recover what we lost. So it's a constant battle that you have, that is going to be like, hey, like, yes, we need to recover what we lost. Very few times we're able.
We've got about 4 minutes. I've got to get this in. So I want your feedback, and we've talked about it before, I actually know, but for all these new people, the skinny injection, your feelings on the skinny injection, whether it's I know there's about 4 or 5 different brand names out there. How do you like? I mean, I know you've prescribed it to your patients.
My honest, yes. So I really love those like injections. I've been working with the injections not only for the diabetics but also for weight loss. And whenever done the right way, they can be life-changing and life-saving. So we can like help people like be off their blood pressure medications. Like whenever you lose 50, 70 pounds, then you don't have to take, like your blood pressure is normal. You don't have to be taking blood pressure medications. Your cholesterol levels like get better. Your hemoglobin A1C, that's the sugar levels, they become normal. You come out of the pre-diabetic range. You have like you can go into like remission with if you are diabetic. So we can mainly like benefits whenever we but whenever they're done the right way under medical supervision, they are great. Yes, we have to understand that they are for a long term, not only for 2 months, not only to get into this new dress that you want. That's not what they're designed for. They're designed to help with the chronic like a treatment, because like also you have to think and understand that obesity is a chronic disease. It is a
Yeah.
disease. It's not that you're making things that it's you're lazy or anything. It is a disease. So we have to treat it that way. So we have to take the medications long term. And along with the like the injections, we also have to do our part. We also have to eat healthier, smaller portions, more protein. We have to do some exercise. The best one for weight loss and maintenance is like resisting exercises. So we have to also do our part. It doesn't exist, no medication exists that they're going to say, oh, just do the injection, go ahead and eat pizza every day, go eat hamburgers, like keep doing your life, don't do exercise. That doesn't exist. I mean, you have to also do your part. Healthy eating habits, like physical exercise, but also like you are going to like increase your protein so you don't lose the muscle mass while you're on these injections, and do some resisting exercises.
Well, I got to tell you, it does curb your appetite. That is for sure. The side effects are still nausea.
Yeah, the side effects are like, again, if you do it the right way, they're pretty mild, like they can be nausea, there can be like constipation. But if we are not careful and we continue giving you the same dose or higher dose whenever you're having adverse effects, we can cause problems. There have been patients that they landed in the hospital because they were dehydrated from vomiting, or dehydrated from the diarrhea, or they were impacted, or meaning blocked, from the constipation. If you're having adverse effects, please do not continue using it. Like, talk to your doctor, and then we have to make sure that we resolve the problem first before we can increase the dose or continue with the medication. And that has been the problems. For the most part, they are well tolerated, and they are no severe problems, unless, of course, let's say you're on the injections, you decided to go to a party and you drank too much alcohol. You can develop a severe problem called pancreatitis, or inflammation of your pancreas. Sometimes whenever you lose weight, you're going to form gallbladder stones, and that also can block some of the ducts of the pancreas. So like that also can cause you to have a gallbladder attack. That's called a cystitis, but also it can happen like a pancreatitis. I had a patient that happened to her, but that's from the weight loss forming the gallbladder stones. But again, if we do it the right way and in medical supervision, they are for the most part well tolerated.
So there's your answer to your question. The folks out there who are writing, it's safe. There are some side effects, but everything's got side effects. And it's just so important you speak to your doctor. Dr. Gamboa, what is your website?
Oh, like it's www.elitecare-clinic.com.
I got to tell you, Dr. Gamboa has been with us for, I think, almost 3 years. We get so much positive feedback about her show. We did a lot of things today we've done plenty of times in the past, but with all of our new listeners, I wanted to get this show in. Dr. Gamboa is with us the last Wednesday of every month at 5:25 Eastern Time. Dr. Gamboa, as always, you always give us the best information.
Time flies. I would love to like keep talking to you and like telling you more, but like we'll do that next time.
See you next month. Thank you, Dr. Gamboa.
Yeah, you're welcome, Steve. Thank you. Bye-bye.
Danielle Gamboa. She's in the Dallas-Fort Worth area. That's going to do it for us today. We'll be back again with you tomorrow at 5 o'clock Eastern Time. See, we're all over the country, so I have to think about where we're at. Again, everybody on YouTube, iHeart, so many platforms are on. Have a good week. We'll see you again tomorrow. Thank you, Rebel.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.